Yes, I can do that. Okay.
Okay, then you can just pause it, right?
Hello, everyone, and thank you for being here. I am so thrilled to be here with you. My name is Sunny, and I am a physical therapist. I work at the University of New Mexico Hospital, and I was trained initially in burn and trauma rehabilitation, working with survivors of burn and or trauma, which really boils down to scar management. You can imagine as a burn survivor, you deal with scar tissue all over your body. It can be disfiguring. It can cause a lot of functional impairments, which is exactly why there is a specialty training for physical therapists in burn rehabilitation. And then in the past, 3 or 4 years, I have had the pleasure of working with more and more breast cancer survivors and women who have had mastectomy, reconstruction as a result of having one of the BRCA gene mutations. And that came about just because surgeons that often do burn surgery are also plastic surgeons and do many breast surgeries. And some of the breast surgeons I was working with started asking great questions about maybe are there things like stretching and massage and tissue mobilization that would help with movement and comfort and quality of life after breast cancer or surgery. And the first few patients that I took on, we really weren't sure. We didn't want to make any promises because there's not a strong precedent for getting physical therapy after breast cancer unless you happen to be seeing a physical therapist that is certified in lymphedema. Much more commonly, those referrals are made. But what I'm finding is that there are a lot of women out there that either don't experience lymphedema, but do experience issues with tissue mobility after breast cancer, chemo, radiation, surgery. Or there are women who get great care for their lymphedema, but also have issues related to scar or lack of tissue mobility in one way or the other. And the lymphedema therapists aren't quite as comfortable treating those impairments. So it's just been the most wonderful journey. I've met a number of breast cancer survivors so far. And what we're finding is that it helps tremendously. It's not rocket science. When you have tissue that's been disrupted in one way or another, it doesn't move as well. It's not as elastic. And of course, tissue mobility, stretching, general mobility, deep breathing, some of the most simple things that we all probably have in our toolboxes, but don't always think to access them, have made quality of life very, very different after breast cancer, at least for the women that I've been working with. So I want to share some of that with you today. Some of what I'm going to present is certainly specific to a physical therapy session with a skilled therapist who's really been trained to do this. And so much of it really could be done at home all throughout the day. When I am working with a woman in my clinic, I might see her once a week and we might get some really deep tissue work accomplished. But most of the work, of course, happens at home throughout your day-to-day life, just to make sure that you're checking in with your body, improving alignment of bones and muscles to the best of your ability so that you can experience optimal mobility and tissue length. Any questions right off the bat, things that you've experienced yourself or you know you want to address during this presentation? Oh, let's see. All right. So just some basics on the anatomy of the breast and chest wall. You've all probably seen images like these ad nauseum in your doctors and surgeons' offices. But it's nice just to get a sense of what the breast looks like. I love this side profile view because you can really appreciate how much connective tissue there is in the breast. And what I want to emphasize and what I learned as I was training as a burn therapist in scar management techniques is that when connective tissue is disrupted, it does heal, it can heal, but the only real mechanism it has for healing is scar formation. So unlike some of the more superficial layers of our skin that can be damaged, torn, blistered, and heal with its original integrity and elasticity, connective tissue can't. If connective tissue is disrupted or injured, it forms a scar. It always will. No way around that. It's how connective tissue repairs itself. And so my job is to think about how we can make sure that although we know there's going to be a scar, or maybe we're dealing with a superficial scar after mastectomy or reconstruction, we want to make sure that that scar has the most optimal qualities. It's as soft as it can be, as flat as it can be, and as pliable as it can be. A lot of women have questions about the color of a scar. Oftentimes for the first anywhere from 6 months to 2 years, the scar can have a pink or red or purple quality to it. And that is normal. That's just the remodeling process of scar tissue. And that color changes no matter what we do to try to affect the texture of the scar. So my focus is really about the texture and pliability of the scar tissue that's forming, whether it's on the surface or deep under the surface. I also included a picture of the chest wall because I think it's important to notice that the breast is surrounded by muscle tissue. And a lot of women come and they're not necessarily having issues with mobility of the breast itself, but shortening of maybe the pectoralis muscle. That's the most common that I see, the big muscle that runs from the front of your shoulder down to the middle of your chest. And really it runs just under the breast. And so it can be very much affected by surgeries or procedures that disrupt breast tissue. Sometimes to the point where women can't reach overhead easily for their activities of daily living, or I'm working with a gal right now who has some very specific complaints. She actually has pretty good mobility of most of her soft tissue, but she says, gosh, when I pick up my daughter or a heavy bag of groceries, I just can feel that muscle in the front of my chest tightening and shortening. I feel a burning sensation. I regret having picked up something heavy for the whole rest of my day, maybe my week. And that's very real. And part of that is a muscle shortening issue. And part of that is actually entrapment of the nerves that run through those tunnels naturally. So it can be a number of different types of tissue that are involved. And the beauty of my job is that it actually doesn't matter what is causing the tightness or where it is. It's just a matter of identifying, yes, there's tightness, there's pain, there's a lack of elasticity. Let's get in there with our hands and really feel around. So I hope what is accomplished tonight is just a sense of empowerment for you and for any of your medical providers, massage therapists that you interact with, that it's okay to touch, it's okay to really get in deep and ensure that you're identifying which of the tissues are affected and figuring out how to lengthen them, how to create more space and more pliability. And a little goes a long way here. You might only gain a centimeter of length in a shortened muscle around the breast, and it makes all the difference in the world as far as comfort and function, which is what is so enjoyable about my job. I get to see really incredible results with work that is certainly not rocket science. So I want to just touch briefly. We know that chemotherapy, radiation, and or surgery can all have different effects potentially, and not always. That's the other interesting thing. I run into a lot of women who've had all three, chemotherapy, radiation, and surgery, and they don't have any functional impairments. They don't have any, the scar tissue is relatively minimal, not a lot of pain, no issues with mobility or function, and that's wonderful. And there's no way to predict very well whether that situation is going to arise after some of these procedures or not. So I just want to touch briefly on the potential effects of chemotherapy on healthy cells and tissues so that we can understand what might be helpful in addressing any tightness or lack of mobility in those tissues. So because you can imagine, chemotherapy is a systemic treatment, a delivery of medication that circulates in the bloodstream so that it can reach cancer cells in many different parts of the body. It can also affect cells and tissues throughout the body that are not cancer cells. Normal non-cancer cells, tissues that are most commonly affected, are those that are constantly growing and dividing. And that's because chemotherapy drugs are designated to kill cells that are dividing or multiplying rapidly. So the most common effects that we see on the tissues that are constantly changing, if you will, are the skin and the lining of the digestive system, hair and hair follicles, your bone marrow, which is constantly producing new blood cells, and cells in the reproductive system. Doesn't mean that other cells cannot be affected by chemotherapy, but certainly these are the most commonly affected cells just because of their rate of growth, the fact that they're more likely to be constantly changing. Another side effect, complication that does come up occasionally is infiltration or extravasation as a result of intravenous chemotherapy. A relatively rare complication, but when it does occur, it can be pretty upsetting, pretty devastating. Occasionally, when the chemotherapy is being delivered directly into the vein, the medication can actually leak outside of the vein for a couple of reasons. One may be that the IV is not working properly. The other is if the vein doesn't have good integrity for whatever reason. It didn't hold the fluid inside of its lumen, and it either broke or leaked, and the medication being delivered leaks outside of the vein and into the soft tissue that is surrounding. When the leak happens, that's what we call infiltration. It just means that there's fluid that came from the IV that's outside of the vein where it should be and in the soft tissue that surrounds. And sometimes this causes really serious irritation and damage to the tissue, and sometimes it doesn't. So if it's just a leak and we think it's going to be relatively temporary, that we call that infiltration. No expected tissue damage or irritation. Some drugs, however, that are delivered as chemotherapy do absolutely irritate and damage soft tissue. That class of drugs is called vesicants. And when a vesicant medication leaks outside of the vein and into the surrounding soft tissue, we call that an extravasation injury. That means that it's basically, if you can imagine, like a chemical burn from the inside out. The medication that was meant to go elsewhere ends up in tissue where it's going to be very irritating. It can often cause swelling, pain, hardening of the soft tissue. Sometimes it's just a little bit of redness or discoloration of the skin around the IV site. Sometimes people come to my clinic and the entire area around the IV site is completely black and hardened and damage of the full thickness of the soft tissue. It really ranges quite a lot. It usually is quite painful. And we often notice that the temperature of the skin and soft tissue around the IV site is cooler than the normal unaffected tissue. So things certainly to watch out for, things that the chemo team is certainly looking for as they're delivering that kind of medication through an IV. But regardless of the reason for the tissue damage, again, I'm going to talk about some very basic interventions that can be quite helpful in improving quality, mobility, and function if you have sustained an injury like that. Shifting gears just a little bit, I also want to touch on the potential effects of radiation on healthy soft tissue. This is a little bit different because of the difference in the way that radiation is delivered. If radiation is being delivered, it's generally relatively focused, whether it's actually focused on the tumor or the affected breast. It's designed to only affect that body area, and it's extremely powerful. So unfortunately, injury of normal tissue from irradiation is a consequence of radiation therapy for some people. And again, no real perfect way to predict whether this is going to happen or not ahead of time. It can be acute, meaning that it will resolve after completion of the radiation therapy, or chronic, which means it could potentially be somewhat permanent long after radiation therapy has been completed. And the radiation can cause soft tissue to become swollen, stiff, and or painful. Most women that I've treated with radiation damage or radiation burns report incredible pain all the way from the surface down to the bony structures of the rib cage and the sternum underneath. It can look a lot of different ways. These are two very different images, but you can appreciate that there's certainly some soft tissue damage there to the skin and probably the tissue underlying the skin. And this happens because radiation can actually change DNA inside of cells. It deprives tissue of oxygen, and it also can release damaging free radicals into the tissue. So of course, the oncology team does their very best to mitigate this kind of complication. And I have such a skewed perspective because all of the women being referred to me have had some kind of complication. So I do see a lot of this type of injury, at least it feels that way to me, probably at least 12 to 15 per year here in our city. And in doing a little bit of research, it does seem like, unfortunately, this is a relatively common side effect. Shifting gears again one last time, just to talk about the potential effects of surgery on soft tissue. So soft tissue, whether it be skin, muscle, or connective tissue that has been disrupted by surgery, heals by forming scar tissue. And what we know about scar tissue is that even under the very best circumstances, scar tissue is only about 80% as strong as normal soft tissue. And it really lacks the elasticity that our normal skin and soft tissue have. And it's one of those things that we take for granted until we lose it, right? The fact that our skin and our soft tissue actually moves and glides quite a bit without any kind of trauma. That is just, it speaks to the body's incredible design. And it's also very fragile. When we see damage to those tissues and scar formation, we see almost an immediate loss of that elasticity, which can be very bothersome to people, regardless of the body area that it affects. In addition to lacking overall elasticity and pliability, scar tissue can adhere to surrounding tissue, causing sort of a tethering is how people describe it. I like to describe it as, scar tissue can often almost wrap itself around structures, almost like a tree growing roots. And it can become very problematic depending upon the body area. Most commonly in the breast, I'm able to feel scar tissue that has actually sort of wrapped itself around the ribs nearby and some of the musculature nearby, tethering the soft tissue of the breast to the chest wall below. And it's amazing how powerful it can be just to get in with my hands and start to feel around and see if I can move the entire breast or area on the rib cage. And it's one of those things that, you don't think about very often and is so variable from person to person. How much does a breast move on the chest wall? It really depends. So if ideally I'm working with women who maybe have only had one breast affected, and I can look at their other breast and chest wall and determine what's a normal amount of tissue mobility for them. But if I don't have that at my disposal, so many women I work with have had bilateral or double mastectomies, and we don't have that ability to compare. Then I just feel around, and in that case, rather than comparing to the other side, we say, well, let's optimize how much the breast can move on the chest wall. And I'm literally in there with my hands. I'm going to move my camera just a little bit so you can see me. I'm literally moving the whole breast. I love circular motions. Those tend to really hit any possible area because a scar adhesion can happen in any plane, in any orientation, if you will. And so some of my work is to actually get in deep in the tissue and find where I feel an actual scar band or a cord, and work my fingers along that scar band or that cord, giving it nice deep pressure. And to me, it sometimes feels like I'm almost kneading bread or kneading dough, trying to figure out how much I can get the tissue to move and give way to create more space and more elasticity. And for some women, this feels just incredible. It's a release, it's a relief. It's the best thing that's happened to them all week. For some, it's very tender, very painful, very guarded, and we have to move very slowly. And that's also what I love about the work that I do, is that it's a very intimate moment between patient and therapist to decide how deep to go and how much movement to try to gain in any one session. Sometimes we're really only trying to gain just a millimeter, just trying to relieve some pressure or tightness or nerve entrapment. And sometimes I'm really in there using my whole body, getting soft tissue to move along the chest wall. So it really depends. And you know your body better than anybody. So I always, of course, encourage that your care be individualized and directed by you. You are the one that's going to know where the stopping point is. But what I've found more often than not is that women who have been through breast cancer and surgeries and procedures are so conservative. They're afraid to tear open a surgical site, or their surgeon maybe 8 weeks ago said, gosh, try not to move too much. Try not to extend your spine. We don't want stitches to come open. And so what I see is women that are very guarded. The shoulder rolls forward and the arm gets tucked into the side. And what I can sometimes help with is just empowering them to say, gosh, it's actually okay to pull that shoulder back, and really quite helpful to try to create that that natural tissue length along the front of the shoulder and the chest wall. And sometimes that's all it takes. And of course, you all can do that for yourselves at home, and probably already have done a lot of that work because it's such an important part of recovery. We could do a whole nother talk on cording or axillary web syndrome. I just want to touch on it briefly. When lymph nodes are removed surgically, sometimes, not always, what is left behind are webs or cords of hardened lymph vessels that are no longer functioning. And cording can sometimes occur weeks after surgery, sometimes months after surgery. And like some of the other items I've talked about, sometimes it's absolutely reversible and temporary. Sometimes it's much more chronic and can be permanent. And what I've learned as a therapist is that all of the same things that we do for any scar tissue anywhere in the body do work for cording. Being able to palpate or feel, where does the cord begin? Where does it end? Could we work our fingers along the length of the cord and actually create more length and more pliability and more elasticity? And of course, only to the tolerance of the person that I'm working with. For some people, this feels great, feels like a release. For others, it's very, very, very tender, and we have to go very slowly. Cording it generally starts in the armpit, in the axilla, and runs down the inside of the arm, sometimes just a short distance, and sometimes all the way down to the palm of the hand. It's incredibly variable depending on the individual. And again, the beauty of my job is that it actually doesn't matter. I just want to feel around, help that person help me identify where the tight spots are, where the tethered spots are, and see what we can do to create more length and more pliability, which inevitably leads to more comfort. All right, now just a little bit about nerve damage and or entrapment. I've alluded to it a couple of times so far. So chemotherapy, radiation, and surgery can all potentially cause nerve irritation and or damage. Just a couple of definitions here. Neuropathy is the general term. It's defined as weakness, numbness, altered sensation, or pain caused by nerve damage. And there's a real wide variety here. Sometimes women experience complete numbness. Sometimes there's a real hypersensitivity. Sometimes it depends on what kind of sensation we're talking about. And that's my job, is to help tease out what type of neuropathy you might be experiencing and to help mitigate the complications associated with that type of nerve injury. This can be in the immediate area of the treatment or in other body areas, just because of the way that nerves work. They start in the spinal column inside of the spinal bones and then exit out into the body all the way to the tips of the fingers and to the tips of the toes. The most common neuropathy actually after chemotherapy is neuropathy in the hands and feet, the very end of the pathway of those peripheral nerves. And this again can be temporary or permanent. Paresthesia is the next definition. This is incredibly common after chemotherapy, radiation, and surgery. And that's the specific type of neuropathy that describes dysfunction or impairment of the sensory nerves. So remember that our nerves help us move and control our muscles. Those would be our motor nerves. They also control a lot of functions in our autonomic nervous system, like sweating and emotions. And then the type of nerves that we're talking about here are the nerves that allow us to feel our environment accurately. So a lot of women after surgeries like this have dampened sensation. They might say, gosh, it's not numb. I can feel that you're touching me, but it feels really different than my other tissue or than the other side of my body, for example. I had one woman recently who I started with, and she said, my breast feels like it doesn't belong to me. She had had cancer on one side, surgery on one side, and was unaffected on the other side. She said, it literally feels like a cold, hard rock that somebody attached to my body with some sort of strap. I don't even know how it's being held on there right now. And when I touch it, when you touch it, it feels foreign to me. It feels like rubber. It feels like plastic. It doesn't feel like it's a part of me. And as we've worked, gosh, I don't even think it's been a full 2 months together. Now that sensation is starting to kind of wake up again. It's still not exactly the same as on the other side, but the sensation is much more accurate. And the texture and the temperature of the breast is so much better. It's now soft, it's warm. When she's wearing a bra and wearing a shirt, she feels like there's actually quite good symmetry. If you didn't know exactly what she had experienced recently with her mastectomy and reconstruction, you would have no idea, which is really different from when we started. And that has been really exciting. The third type of neuropathy that is somewhat common is entrapment neuropathy. So this is a condition where the nerve becomes compressed or trapped between two other structures of the body, resulting in neuropathy, that irritation or damage to the nerve itself. And unfortunately, for women that have been through, especially all three of these procedures and surgery, the entrapment neuropathy can be exacerbated by swelling, other soft tissue damage or tightening, and guarding, that fear of movement, which causes increased tightness and lack of tissue elasticity or mobility. So it's a bit of a vicious cycle. You might actually have nerves that are irritated or damaged, and then the surrounding swelling, the shortening of the muscles, the holding of the position that is a shorter, more guarded position actually makes the entrapment worse. So the nerve symptoms can actually get worse over time, which is very upsetting for people that are experiencing this. It's the only symptom for some women that actually keeps them up at night, making it difficult to sleep or relax. Very distracting when you're not getting accurate information from your nervous system. All right, moving on to the fun part here. Treatments to improve tissue mobility and comfort. Some of these you may have heard of and may already be doing. Others might seem a bit more foreign. And I do encourage any kind of discussion here. If you've experienced some of these things, if you want to share or ask questions about things that you're experiencing, I'm happy to field those questions as well. Very top of the list in my book is relaxation and self-care. This is sometimes easier said than done in our busy lives. But sometimes it's just taking that time for yourself, whatever that is. It's different for every person, and making sure that you're allowing yourself to experience that relaxation and engage in those self-care activities, ideally every single day. And so many of us have so many different roles, and we're so busy that we just don't. It gets put on the back burner and it doesn't happen. But it's probably the most important thing to healing and recovery, as many of you know. And I can't stress it enough. Sometimes it's just a matter of pausing to make sure that the quality of your breath is nice and deep. And we'll talk a little bit about some specific breathing techniques here in just a moment. Second on the list is just movement. So whatever it is that seems challenging or limited, just like everything in life, that's what we need to pay our attention to shift our awareness to. It can be so emotionally painful when part of your body isn't moving normally and the tissue isn't gliding normally, and it's painful, and you feel like there's an asymmetry there that might even be noticeable to others, and that adds a whole nother layer. So just trying to be aware of your movement patterns and make them as symmetrical and luxurious as possible. Really enjoying the movement that you do have available to you, and identifying where maybe there's a limitation, and maybe that more awareness, more focus, more hands-on could help increase the quality of the movement in that body area. And of course, these things are all related to one another. When we're moving normally and our patterns of movement are symmetrical and stable and also free, if you will, kind of liberated, that actually facilitates better alignment of our joints and muscles. So often musculoskeletal pain that we have is actually because our alignment is not what it should be. The best example that I can think of, especially in this culture in our country, is that so many of us spend so much of our day with our head sort of jutted forward in the way that we communicate with one another, certainly being on a computer or a keyboard all day. We tend to let our head drift forward way beyond the support of our spine. And that causes a lot of problem, even by the end of an hour, or certainly by the end of a day. If I am jutting or drifting my head way out in front of the support of my spine, all of the muscles that attach feel as though they need to jump in and protect my very important and potentially vulnerable neck. And so the muscles, which are big and strong, are going to clench down in order to try to protect my neck, which the body senses is sort of out of its natural alignment. And this happens to me literally hourly during the day. I notice that I'm actually wearing my shoulders as earrings, and I have to just kind of stop and think about, what is the alignment of that joint or muscle? Where should that actually be so that it's well supported? And once you find the right alignment of joints and muscles, that allows the shortening of muscles, the guarding, the tensing to really just release and naturally find length, because the bones are quite good at supporting themselves when they are in good alignment. It's really when we get out of alignment that the muscles grip and can be very painful. So just some awareness around that is really helpful. I've talked a lot about hands-on technique. That's my favorite, of course. Massage, whether we're doing scar massage on the surface or deep down in connective tissue, and also deep tissue massage of other tissues that might not be scar tissue. Maybe, the breast or the chest wall literally just needs that deep tissue release. Touch is so powerful. Most women I work with do find that touch really provides relief, even in a very painful area. That's the first thing they want me to touch. They'll say, gosh, I've just had this terrible knot on the one side of my chest. Sometimes the pain even shoots across to the other side. It almost feels like I'm having a heart attack. It's so intense. And I say, oh gosh, should we not massage that part today? I certainly don't want to cause you any discomfort. And 99% of them will say, oh, no, please, can you start there? Lay your hands on that spot. Let's put a little deep pressure. Let's see if we can work it out. Again, it reminds me of kneading dough, just gently, carefully, with all the intention and love that is deserved. Let's see if we can soften those hardened spots or those tethered spots. And it's just, you can just feel the tissue move under your fingers. It's so phenomenal. It's so enjoyable. I want to make a quick note about scar massage. It seems about 50-50 whether surgeons are instructing people to do their own scar massage when they leave after surgery or not. Some people are very afraid to touch their scars after surgery. And I am here to say that scar tissue needs to be touched. It's a very important part of resensitizing the area. And it's a very powerful way to soften and flatten and increase pliability in the scar tissue. The one caveat, the one thing I warn people about is too much friction. I said that scar tissue is actually more fragile than regular tissue, normal, unaffected tissue. And the mistake that most people make, I'm gonna see if you can see me. I'm gonna hold my hand up just in front of my camera here. So if I have an injury or a scar to the back of my hand and I come in to do massage and I'm rubbing a lot, there's a lot of friction on that tissue, the scar tissue is actually going to break down and blister very, very easily. If you ever notice a blister on your scar, that means there's been too much friction. The top layer has actually separated from the bottom layer. It's not the end of the world. It generally will heal. But if we can avoid it, let's avoid it. So more than friction on the surface, scar massage is a nice deep pressure. And feel free to kind of do this with me, whether it's on an affected area or just to see how tissue glides normally when we put nice deep pressure on it. Again, I love those circular movements. If you just plant those fingers, and I'm using 2 fingers right now, sometimes if I'm working on somebody's entire breast or chest wall, I'll get my whole hand in there. But it's always a nice, even deep pressure so that I'm asking the more superficial tissue to move in comparison to the deeper tissue. I'm never just rubbing on the surface. That can feel very irritating and can cause tissue damage. So always avoid friction if possible when performing scar massage. There are other types of massage on healthy tissue that very intentionally involves friction, and it might feel nice or create space under the skin. And that's of course fine when that tissue is healthy, but if it's been interrupted and scars forming, we want to be very, very careful of that. Separate from scar tissue is the mobilization of adhered, firm or shortened tissue. So by far the most common that I see is the example that I spoke about earlier, where the entire breast, before reconstruction, after mastectomy, if there isn't going to be any reconstruction, I often feel, I'm going to move my camera down just a little bit again. I often feel that the entire area of tissue is just stuck. It doesn't want to move in any direction. And so just that nice, gentle, multi-directional movement of the tissue is so powerful. And if that feels good, you can go in quite a bit deeper. I'm able, with patients that I'm working with, women that I'm working with, I'm able to actually sometimes lift the entire breast tissue up and actually feel underneath and feel ribs and feel muscles and feel pockets of swelling where I might be able to put a little bit of pressure and encourage that fluid up back toward the heart where it can be recirculated instead of being stuck in a pocket. That fluid very commonly accumulates on the side of a breast or a mastectomy site. And we can often just gently get it to move and be recirculated if we can get it back toward the heart and the main lymph duct. So just, it's different for everyone, of course, but wherever it feels like that tethering, that limitation is, it's wonderful to really get in there with hands, with fingers, and feel around. And whether you're doing this on yourself or you're having a partner do it or coming to a skilled therapist to do it. Not being afraid to really touch and feel and find the tight spots. You often will find a little cord or a little scar band, and you can actually get in there and massage it and get it to be longer and more elastic and with more space. And that's where we find better outcomes. Stretching, of course, goes along with all of this. So rather than doing the mobilization with your hands, sometimes just moving that body part, being able to actually create space because you're asking muscles to elongate, or you're taking a big deep breath using your diaphragm and other respiratory muscles and just holding that stretch to allow the tissue to really elongate and remain elongated. So I have got a couple of pictures coming up just after this, and I'm also happy to actually do the stretching and or field questions about the stretching if you've got them. And I always try to combine stretching with deep diaphragmatic breathing. So we all breathe naturally, whether we're thinking about it or not. But if we can shift our awareness and really focus on the quality of the breath, it can make all the difference in the world. So our diaphragm is a huge muscle that sits at the bottom of our lungs, and it is attached to our rib cage at the bottom of the rib cage. If you can imagine kind of a big triangular jug that is the lungs, the diaphragm is the bottom of that. And so when we really engage our diaphragm and we're breathing in, nice big deep breath, and it does help if you breathe in through your nose while keeping your mouth closed. Feel free to do this with me. Nice deep breath in through the nose, mouth closed. You will feel your diaphragm engage. And as you take a nice big deep breath in through your nose, you'll actually feel the diaphragm spread and the ribs will descend a little bit, get a little bit lower. And the ribs on the side will actually spread out to the sides. It feels like a big billowing bagpipe, if you will. And when we take a nice big deep breath and we engage our diaphragm, we allow more space, which means more oxygenation, which is good for tissue. It allows us to relax, which is good for tissue length and stretching. And it's actually a stretch from the inside out. There are some places along the chest wall underneath the breast tissue that can't be reached with our hands. It's impossible to get all the way up under that breast tissue or under that mastectomy site sometimes. But I like to get as close as I can, especially if I find a spot that feels tethered or adhesed or stuck, and then have the person take a couple of really nice, deep diaphragmatic breaths, and they'll feel a release and a stretch from the inside that pairs very nicely with the stretching. We often think of stretching as, stretching from the outside of the body, which is, of course, the easiest way to do it. But if you pair traditional stretching with diaphragmatic breathing, you get the best possible result in every way. I do see that there's a question in the chat here. Oh, great. Question, when can I start stretching after the lumpectomy and lymph node removal? Great question. As soon as the stitches are out, if you had stitches, or the wounds are completely healed, closed. So the only time that we're careful about stretching is if the wound is still open along the incision line, or maybe I work with a lot of women who have wounds for other reasons. Maybe the radiation actually caused wounds. We're a little bit careful about stretching because we don't want to pull the wounds apart. We don't want to pull stitches apart. But as soon as the stitches are out and or the wounds are closed, we start stretching. And the beautiful thing about stretching and all of this is that you are in charge. So it doesn't mean you have to do the most dramatic stretch and go all the way to the end of the range of that movement. It might be a very subtle stretch, a very small stretch, and a very small range of motion. And that is not any less powerful than a huge dramatic stretch to the end of the range. It's just thinking about how much can I move that? And unless you're experiencing really severe neuropathy, your body is going to tell you when the end of the stretch should be. And I always respect that when the person says to me, oh gosh, that's a little intense. I'm starting to feel that burning sensation again. Or that actually feels like it might rip, like it might tear. That's where we stop. I never want to traumatize tissue anymore, of course. And that the beauty of stretching, the definition of stretching is that it's very slow and it's very controlled. So this should always feel good. It might feel intense. You might feel that the pulling that is the stretch, but it never should make you feel excruciating pain, sharp shooting pain. That's when you know you need to back off a little. Doesn't mean you stop stretching, just maybe do it a little more gently or in a smaller range of motion. That's such a great question because it comes up so often. The surgeon often will meet with you frequently right after your surgery. And then you don't meet with them for months and months and months sometimes. And no one is there to tell you, now is the time to go ahead and start stretching. And that's when I love when people actually get referred to me for physical therapy because we can make that decision very carefully together. But really the answer is sooner than you think, as soon as the really acute incision or wounds are healed. And for most people, that's a couple of weeks. That happens pretty quickly.
Okay, thank you. Thank you.
Yes, thank you. Okay, this is me on my bedroom floor. This is how I like to end up after every single workday as part of my self-care. This item, I don't know if you all are familiar with this wonderful item. I don't know how well you can see it in the picture. I also have one here with me. This that I am lying on top of is in the picture is called a foam roller. It's just a roller, a cylinder made of foam, and it's pretty dense foam. This one is my favorite. It's 4 inches in diameter. You can see it next to my palm here. There are foam rollers that are much, much, much bigger and for different purposes, but this one is perfect for realigning the spine and at the same time opening up the front of the chest and sometimes just lying down as I am in the picture with the top of my head on one end and my tailbone on the other end. And you do want to make sure that your whole body is supported by the foam roller. You don't want to be falling off on one under the other because that's too intense of a stretch for most people. But just the act of getting down on the floor, you could also do this up on a bed or on a massage table if it's difficult to get onto the floor. But I love getting down onto the floor at the end of a long day because it really reminds me of what my spinal alignment can be. Because I get very out of alignment during my workday every day, no matter what, no matter how mindful I am. I notice when I first lie down on the floor, I almost feel like I'm falling backwards because spinal alignment, neutral spinal alignment, healthy spinal alignment is not something that most of us maintain very well all day long. And most of us are more forward than we need to be. Ooh, great question about a referral for physical therapy. In New Mexico and many other states, we are called a direct access state, which means you don't actually need a referral to see a physical therapist. However, if you want to go through insurance and have insurance reimburse you for the physical therapy or reimburse me for the physical therapy, it is a good idea to get a referral. For most third-party payers, they're going to want a referral. And most, whether it's your surgeon or a primary care physician or a nurse practitioner that you've seen, it can come from any kind of medical provider. And it's very easy to write a referral. It's just either a little piece of paper or a memo sent in a computer remotely that just says physical therapy for tightness. And it gives me full reign to do whatever you and I think are most appropriate for you. So even if you're not meeting with your surgeon, if you've had surgery and you're not meeting with your surgeon regularly, this can come from any provider in your life. My provider is so wonderful. My primary care provider, I can just send him an email and say, I think I need physical therapy. My hip is bugging me. And he will write it. He'll send it directly to my chosen clinic without even seeing me. So it depends a little bit on your relationship with a provider, but a referral helps so that we can get reimbursement, but it's not actually necessary. In the state of New Mexico, you can access physical therapy without a referral, which is really good. When I lie on the floor, I like to spend a solid 10 minutes just lying on my foam roller, as you see in the picture. And while I'm lying there, I'm really checking in with my body. I'm scanning my body from top to bottom to think about, gosh, is my head over to one side or is it actually in the middle? Is my back really popped up and forward and off of this foam roller? Or can I actually feel each one of my vertebrae making contact with that foam roller? And how could I relax, breathe, settle into this position so that I can actually feel the back of my head and each one of my vertebrae in my spine touching this foam roller? And that for me takes about 10 minutes to really settle in and really gain the benefit. But if you don't have 10 minutes, even 30 seconds to just check in, take some big, beautiful, deep diaphragmatic breaths and enjoy the experience that the foam roller gives. Once I've been on for about 10 minutes, one thing I do want to point out here, I'm also very intentionally opening my chest by rolling the palms of my hands upward. In this case, I'm lying down, so I want my palms of the hands up toward the ceiling. And you can see that now, without doing I'm not really doing any active stretching yet, but just being in this position gives a lot of length to the front of my shoulder. I can feel that all the way from my sternum, my breastbone, across both of my breasts, across my rib cage. It just feels incredible just to lie there and take big, beautiful breaths and check in and try to clear my mind from the busy day. I know people that spend an hour on the foam roller when they get home. So what I notice after about 10 minutes is that my tailbone starts to get a little sore. That's really the main reason for me, I want to stop after about 10 minutes. So you have to listen to your own body. As soon as it feels like you want to break, because it is a bit of pressure on the spine and the tailbone when you're lying there, of course, come off the foam roller. And the most incredible part of the experience is in those first few seconds when you come off of the foam roller. You just get this incredible, for me, it's almost like a tingling sensation. It's new blood flow to the area, more oxygen to the area. I finally find that wonderful neutral alignment of my spine where my bones are actually supporting themselves and my muscles. And it's just incredible. And it takes, for that part, you'd only need to spend about a minute on the roller and then get off of it and lie just on the ground or on a mat or on a pad. And wow, it just feels luxurious. And it's so simple. I have access to these foam rollers because I work in a therapy clinic, but they're also very easy to find online. I've even seen them in a lot of the medical supply stores. At Target now has a wonderful section with yoga mats and yoga blocks, and you can usually find a foam roller. So highly recommended home equipment is this 4-inch foam roller. I'm gonna go ahead to the next pictures. My next favorite move, I call these side lying arm circles. You can see I get on one of my sides, and eventually I want to do both sides. So it doesn't matter which side you start on. You'll know, your body will tell you, maybe you've got some tenderness on one side and you want to wait on that and get the body warmed up and moving first. But basically, I'm just making big sweeping circles with my arm. And the arm that's making the big sweeping circles is the top arm. The bottom arm stays on the ground and actually engages the floor a little bit. So a little bit of gentle pressure downward into the floor to allow stability in my shoulder, my rib cage, the whole rest of my body, so that I feel that really free movement of my arm in a big circular pattern. I do it about 3 times in each direction. So I'm in this set of pictures, I'm going from straight out in front of me to above my head And you'll notice that my head follows my top arm. So as I'm sweeping then to the outside, I actually look toward my palm that's moving and then back down to my hip and around again. So in that situation, I'm going upward in comparison to my own body. After I do that 3 times, I switch directions to make sure that I go both ways with my shoulder. And then I roll onto my other side, very mindfully, carefully, with big, beautiful breaths, and do the same thing with the other arm. And sometimes this is all I have time for, and that's okay. These 2 are just really good bang for your buck if you like the way that they feel. I'm doing huge circles in these pictures because I've been working really hard at this, and I've created a lot of tissue length at the front of my chest and in my spine. When I first started doing these, I couldn't get my other arm on the floor. In this lower picture on the right of the screen, I've got both arms against the floor, pressing outward, creating length across my shoulder blades. And I couldn't come close to that when I first started. My top arm might be straight up in the air, but as long as you're doing big, nice, beautiful circles, you're lubricating joints and creating muscle length and soft tissue length, which is really, really helpful. Whoop, there we go, both variations there. I keep my foam roller nearby. Oh, and when I'm doing these sidearm circles, I happen to have a nice little pillow that I like. You don't have to have any pillow under your head. And it occurred to me as I was putting this together for you all that you might even be able to use the roller under your head if you feel like you need a little support for your head. It doesn't have to be a pillow. It could be anything or no pillow at all. But I do keep the foam roller nearby because I also find it a very nice prop. It turns out that when I put my fingertips on each end of the foam roller, that's about the most natural plane of motion for the shoulder joints to keep my shoulders safe. I don't want to do a really intense stretch backward or forward and risk stretching a nerve or irritating a nerve that's already irritated. But this diagonal plane of motion for the shoulders is very, very safe and very natural, and it creates a lot of lubrication for the joint when you move it in this way. So I take my foam roller up and over my head, only as far as it will go. I'm now able to get it all the way to the floor behind me, which you'll see in the next picture. But when I first started this, I might only be able to get it just above my breasts in front of my chest. That might be as far as I could go, and that is okay. I go as far as I can, I stop, I take 3 nice big diaphragmatic breaths, and then I rest. And you can feel the tissue length. When you do 3 in a row, you can feel that you can go a little bit further each time because of the benefit of stretching. Stretching actually elongates the tissue. I'm so proud of this picture. I can now go all the way over my head without my ribs popping up off the ground or my spine popping up off the ground, which is what happened to me a lot at the beginning because of a lot of tightness. Now I can set the foam roller down and actually rest my hands on it. And I said it's about 4 inches in diameter. So 4 inches off the ground there. And that is just the most incredible full body stretch for the front of my body and the back of my body. A lot of what I focused on tonight is stretches for the front of the body, of course. But what I've learned in doing this is that in order to have mobility and stretch in the front of the body, you have to have strength and stability and awareness of the back of your body. It's whole body. No matter what part of the body you're trying to move, it involves your whole body. So mindfulness, awareness, keeping my tailbone rooted to the ground, but not digging into the ground, finding that nice alignment, which I found by lying on the foam roller at the beginning, trying to keep that alignment as I move my arms above my head. Really easy to do and really powerful. If that feels good and I feel like I can take it to the next step, I actually go ahead and extend my knees all the way out, only as far as feels good. If I get any pinching, burning, stinging sensations anywhere in my body, I back up to the previous step. You never want to force a stretch. And you always want to make sure if you're stretching that you are in good joint alignment. We don't want to be doing really crazy dramatic stretches until our tissue is really ready for that. And this is a crazy dramatic stretch. I'm not sure if you can even appreciate that, but if you have tried it or when you try it, wow, it's more than meets the eye. Just a couple more here. This one is nice after I've finished what I want to do lying on my back. I sit up, you can see that my legs are off to one side. So just like other stretches that are to one side, I want to make sure to repeat this on the other side as soon as I'm finished. Sometimes it's enough for me to do just the stretch that you see there on the left, where I'm holding on to my outer ankle with one arm just to keep that shoulder earring out of my ear and down and seated. When I'm trying to keep my shoulders down and seated in order to move my arms freely, it almost feels to me like I'm sliding my shoulder blades into my back pockets. A lot of times when we go to move our shoulders, the whole shoulder blade, the whole quadrant of our body comes up together. And that's not a healthy alignment. You'll feel that right away. It pinches, the muscle actually shortens. It does not feel good. So the trick is to allow your sternum, your breastbone, and your ribs to descend with those nice big deep breaths and to stay rooted while you bring the arm up over your head. And that's, again, harder to do than it sounds. But that's where I'm holding on to that ankle there, is to keep my shoulder nice and seated and stretch with the other side. If I'm feeling really good and really mobile, I bring that arm that's up in the air back behind me. And as you can see, just kind of stretch backwards in an arch. And wow, is that a huge stretch over my entire breast, my chest wall, all the way down to my hip bone in the front and to the top of my head in the back. It feels really incredible, but I only do that when I'm really feeling warmed up and ready. There are some nights where I just can't. I don't feel like it's a good time, and that's really important to respect. Stretches and or massage for cording. What I have learned in my clinical experience is that the only thing that's different about cording than other scar formation is that it's a little more stubborn. It doesn't give way quite as quickly. So the first thing I'd like to say about cording is be patient. Sometimes just starting, all these same stretches are great for cording. All the same type of massage is great for cording, but I just back it off a little bit to make it more gentle, more sustained. I might get in to an armpit and start to feel a cord. And rather than moving to the next spot right away, I might just sit in one spot, put nice deep pressure, maybe even before I start doing little circles. I might just stay in one spot and put pressure on the cord, have that person take a big, nice, deep diaphragmatic breath, and that might be enough stretch for the day. We might not go any higher with the arm or any bigger with the breath. But what I have been so happy to find, when I first started looking into cording, it was a little discouraging. A lot of the resources I found said there is no treatment. We have to be careful not to exacerbate it more with more inflammation, which is true. But as long as you're being mindful, gentle, and you're really listening into your body's cues, it actually is very allowable, very helpful to get in there, massage, put deep pressure, increase length, just do it very slowly and very carefully and only to your tolerance. And if you're stuck there where you're not sure how hard to push, or you feel like it's making symptoms worse instead of better, that might be a great time for a referral to a physical therapist to problem solve that together. Sometimes no physical therapist is needed if you're doing it all on your own. But I do see women who have sort of stubborn chronic cording and they want my help to problem solve better movement. Very, very, very common. But all of these are safe and helpful for cording as long as you move slowly. I think this is the last set of pictures. Oh no, there's one more. As I'm getting up from my seated position, I take advantage of the fact that I'm all nice and warmed up and stretched out. And I love this pose on the left. In physical therapy, we call it the elephant stretch. I know it's called different things in different practices. But now I'm using the ground as my anchor point. And my hands are stable as I move my chest and rib cage and trunk into a more upright position. I've now gotten to the point where from this position, I can actually walk my hands slowly toward my feet. And with that, I get a more and more intense stretch in my chest wall and my armpit. And then I can just roll on up and make it graceful and feel really nice, so that just getting up from the floor is a stretch for me anymore. I try to make it all really meaningful and mindful. And then some of you may have already been taught the stretch called the wall crawl, where you just slowly use a wall or a stable surface and move your fingers carefully up the wall to stretch. Same idea as a stretch in midair, but you're using a stable surface to kind of guide you. I have found that the foam roller really helps. I actually just roll the roller under my palm up the wall, and that gives me something to kind of push on and hold on to, which feels nice to me when I'm tight. It also helps me kind of mark my spot on I use my armoire because it's handy, it's right there. And I can tell, oh gosh, yesterday I couldn't get past that upper panel of the doors, or I was stuck at the doorknob. I didn't get any higher than that, and that's fine. And then I can really mark my progress as I get higher and higher and higher with my arm stretch against the wall or the stable surface. Last but not least, this one has to do with alignment. Such an important activity. I try to do this all day long. I do it when I am in my car driving at a stoplight, a red light, and I know I'm going to be waiting for a moment. Instead of using the foam roller when I'm in my car, I just use the headrest. And this is how you make sure that your head and neck are in line with the rest of your spine. Just a very gentle push straight back from the back of your head against the headrest, against the foam roller. It is just incredible. It looks like nothing at all. It aligns your spine. It helps your lower abdominal muscles fire and helps support your lower abdomen so that your chest can be more mobile and comfortable. You'll feel it right away. If you happen to be sitting in a spot right now where you have something behind you, give it a try. Shoulder blades against the back surface, back of the head, right in the center of the back of the head. And more so than tilting the head up to look up, you're actually looking straight forward, but just pushing gently against the back of your head. And it does wonders to strengthen and stabilize muscles in the back of your neck, which many of us have very weak, very short, very tight because we don't work on it enough. And then it opens up the whole chest. Every woman that has ever come to see me, I send home with this exercise, especially when you just happen to be sitting in your desk chair or driving a car against the headrest. Really, really powerful stretch that doesn't take a lot of time. It doesn't take any time. I now do it in midair as people are talking to me. I'm sitting in a meeting or doing a talk like this, and I just think, okay, press back against the back of my head, engage those cervical muscles, and open up the front of the neck and the front of the chest. And it's just incredible what the benefit of that is. I want to make sure to wrap up in time for any questions that you all might have. And I've put my contact information, my email on the bottom of the slide. I happen to work at University Hospital here in Albuquerque, but I'm always happy to collaborate with providers in other parts of the city or parts of the state. If you might be already working with a massage therapist or a therapist, and I can help share some of this information, I'm always happy to do that, or field individual questions. I'm always available by email for anything that anybody needs. Thank you all for your attention and for being here. And I'm happy to stay on as long as people want to ask questions or not.
Sunny, this is Allison. Before you jump off and whatever happens with questions, I just wanted to thank you so much for sharing your time and knowledge with us this evening. It was such a super informative presentation, and I am sure that you will have quite a few women coming to see you. Hopefully, I know I'm on that list as well. So thank you. We so appreciate it.
Of course, it's been my pleasure to be here. It does occur to me that since I've muted people, they might not be able to unmute themselves. Is it best for me to unmute people at this point, or are you able to unmute yourself?
I unmuted myself, and I just wanted to say hello and thank you. It was great information. I'm definitely going to call my oncologist tomorrow and get a referral, because I had a bilateral, and I recently did see my oncologist's assistant, and she did give me a recommendation or a referral, but I haven't heard back from them. So this was a good class, a reminder, because I definitely feel like I'm not in alignment, and I will try those stretches tonight. While listening to your presentation, I was at home, and I'm here doing, just the basic stuff to keep up with my house. And I feel so much like pain and like numbness and even like burning, a little bit of burning in my arm and my back. So I'm definitely going to try the stretches. I will go to the store tomorrow and get a foam roller. I've been wanting one. And yeah, so you'll definitely be seeing me like soon. I hope to see you next week.
Oh, I love this. I love this.
Yeah.
Thank you for sharing that. Yeah, what you're describing sounds absolutely normal considering what you've been through. And I think there is possibility to improve alignment and the symptoms so that you can live your life and not be distracted by that. Wow.
Yeah, because I mean, I'm at work. I'm I'm at my desk. I'm at the computer all day, and I have one of those rising desks. So there, every hour, I'll try to stand up for an hour and then sit for an hour, stand up for an hour and sit for an hour. But I just don't feel. I just can't do a lot. Like I just basically did the minimum tonight, and I'm already feeling it in my right arm, under my arm, my back, my lower back. So I'm going to try the stretches. I'm going to do whatever I can. And I'm excited to see you. I was waiting for this. Yeah.
Oh,
So
that's
thank
good to
you.
hear. Of course.
Hi, this is Veronica. When you said that your patient described a cold, hard rock feeling in her boob, I can so relate to that because that's what I feel. Is there a way to specific massage? I'm going to a lymphedema therapist currently, but they're focusing more, I guess, on the arm. So
Yeah, I keep hearing this story. Their job is to focus on the arm because that's where the lymph nodes and the lymph vessels are. What I'm finding is, I think the cold is, and when my patient said that and I felt her breast, it also felt like a cold, hard rock to me. This is not something that you are imagining. And I think it has to do with blood flow. I think with everything that you've been through, it's possible that that breast is not getting enough blood flow. So touching it if you can, with your whole hand, or having a therapist do it, or a partner or a family member, and moving the whole breast. This is where I'm going to move my camera down a little bit. It was this gal that really made me realize that I needed to just get my whole hand on the breast tissue. I was at first started out kind of with a few fingers at a time and almost being a little too ginger. I was just kind of going around. I was afraid to hurt her. I didn't want to get in too deep. And now when she comes to clinic, this is the first thing I do. I lay my whole hand on top of her breast and just move it in nice big circles. And then I move the breast up, down, side, side. And as I'm doing that, I feel for other spots that might be tethered, because wherever there might be tethering, that's where the blood supply might be kind of cramped. It may be that the blood supply is not getting through efficiently. And with her, we notice from the beginning of a session to the end of a session, it starts to feel warmer, softer. The color changes from a pale, purplish color to a nice pink, well vascularized color. So I think more touch with more surface and really moving does it feel comfortable to you to actually move the entire breast against the chest wall? Or does that make it worse, or is that painful in any way?
in some places it's painful, but other places it's not.
So I would start with the places that don't feel painful to touch. We really want this to be relaxing. Start with a spot that feels okay to touch and really see how deep you can push. Can you actually even press the breast further against the chest wall and then release? Press and release, almost like a little pumping action. That sometimes will literally just create enough space to get better blood supply. And I think that's a huge part of it.
Okay, thank you. I had asked a surgeon about the cold breast, and he said it had to do with maybe I had thin skin because my breasts are cold.
Yeah. I noticed that right away when I first started working with breast survivors. The tissue feels cold compared to the other tissue. And it could be a lot of different reasons. And what I love about my role is that it doesn't even matter to me why. It's just, gosh, what can we do to improve circulation to the area, to improve comfort? And some of it's just so darn simple. It's just really, a lot of the women that said to me her breast was a rock, she had also gotten to the point where she didn't look at it much or touch it much. It's almost like she had kind of disconnected from it because she wasn't happy with the outcome and it didn't feel like part of her body. And part of it is just kind of loving it and acknowledging it and reincorporating it into who you are. It sounds a little hokey, but honestly, I think some of it is just that we start to kind of ignore parts of us that don't feel right or cause us pain. We just want it to go away. And the more we can kind of bring it in closer, touch it as constantly as you can. If you feel comfortable with other people touching it, touch is really powerful. And then also there are those wonderful, mine is actually a cloth bag filled with rice. Have you seen these? A lot of people will actually drape them over shoulders to get muscle relief at the end of the day. You can either cool them a little bit or warm them a little bit. Mine is just a cloth bag filled with rice, and I put it in the microwave just for, 45 seconds. I don't want to get it so hot that it's going to feel uncomfortable or cause a burn. But if you warm it up just enough so that it feels nice and warm to your skin, sometimes it's literally just a matter of helping it along, warming it until it can warm itself. And it can feel so nice. And that will also improve blood supply. The warmer the tissue is, the better the circulation.
Thank you. Thank you very much.
Yes. Wonderful questions. And of course, you all are the real experts because you know exactly what this feels like. You know what works, you know what doesn't work. And it's important to listen into that as well. Some things that I try for some women don't work at all, even though they were really brilliant and successful for someone else. So continuing to problem solve and be creative and being open to new options is also, of course, so much a part of the journey. Anybody else have a specific question that I can answer or anything that I need to repeat? All right. Thank you again for being here during an evening when I know you probably have a lot going on. It's lovely to see all of your beautiful faces and hear.
Thank you, Sunny. This has been really, really helpful. So I really appreciate it.
Excellent. Someone just asked about copies of the slides. I think I'm assuming, Allison, the best way to do that is maybe just to email the presentation to you and then you can post it or email it out. Would that work?
That definitely will work. And then the other thing, ladies, is Sunny is recording this or has recorded it tonight. So we'll go ahead and get that up on our YouTube page as well. So you'll be able to review the slides there.
And I will say, this is Carrie. I was able to see Sunny once, and this app was before her surgery. And since then, I've had to undergo chemo and then lymph node removal, and then I'll be undergoing radiation. But Sunny, it's so funny because I just feel like you have such a unique expertise that nobody else has, as far as what so many women are like. I felt the hardness in my breast. I felt all those things. Now I have cording from the lymph node removal. So I will definitely be reaching out, but I think your services are so unique. And I want to say, like, the first time I saw you, I could have, even that one time, and being able to, feel like I can manipulate my breast a little bit more, that I can move it around in certain ways, just gave me so much more confidence in the way that I could potentially, make my chest or breast feel better. So I would for anybody on this call, absolutely reach out, because I feel like it's just an amazing service to have and treatment from you. So.
Oh, thank you for sharing that. That means so much to hear. It's wonderful here, and it also breaks my heart to hear a little bit, because I wish this were just commonplace, automatic after any kind of procedure, that everyone got this kind of care. And what I'm learning as I'm meeting one woman at a time is that not everyone is getting this advice, not everyone is getting this information, not everyone feels empowered to touch and get in deep and make that change, which is it just breaks my heart that it's not a standard part of the procedure. I think it's so meaningful.
Agree.
Anybody else? All right. I'm still happy to stay on, but I want you to get back to your evenings and your life and your loved ones, and reach out to me anytime, whether you've got a referral and you want to actually schedule a visit, or maybe you just have a question, or you found another therapist that's willing to work with you, but maybe doesn't have the experience. I'm always happy to help in any way that I possibly can.
Thanks again, Sunny.
Of course. Thank you.
And if you're ever open to doing another one of these again, because, some of the women stick around for a few years, but we always have new warriors coming in. So if this is something we could do maybe even biannually or something, I think that would be really great, because to echo what Carrie said, it is such a unique and important service to make available. So we're so grateful to you that you've done that.
Yes, I'm happy to do it anytime. Or if there are other topics that people want to explore that I might be helpful with, just reach out. I'm here in town and so happy to help.
Okay, well, maybe when you email me the video or the slides, if you have a couple other ideas for presentation topics that you would feel comfortable speaking about, go ahead and shoot me those too, and then we can kind of figure out where to fit those into the lecture calendar.
That sounds great. Thanks again for having me. This has been such a pleasure.
Thank you, Sunny. Have a beautiful rest of your evening.
Thank you. You too.
Okay, bye.
Bye.